So the prostate itself is a gland that's located just beneath the bladder, and it's a gland that's important for sexual function, and it's important for fertility. It's also important as a conduit for urine. The prostate is what carries urine from the bladder out to the urethra. Beyond those three functions, it really doesn't do much of anything important, and like any organ in the body, has the potential to develop cancer. It's actually the most common solid organ to develop cancer in men. So other than skin cancer, it's the most common malignancy that men can develop. So tragically, the disease is relatively asymptomatic until very late in the course. So you hear a lot on TV about asking your doctor if you hear about or you feel X symptom or Y symptom. Really, it's a remarkably asymptomatic disease until very late in the course. Things like changes in your urination are rarely related to prostate cancer. Occasionally blood in the urine, that's something that we as urologists would want to know about. That can be a sign of prostate cancer, but it's unusual. And then for advanced disease, we look to things like bone pain that's unusual. We look at swelling of the extremities as something that's more unusual but can be a sign of advanced disease. Weight loss is something we'd want to know about as well. Men who are over age 50 are at the greatest risk for developing the disease. Really, the older you get as a man, the more at risk you are for developing some form of prostate cancer. Really, I think what you're asking is, among men, who is perhaps at the greatest risk? There are some genetic predispositions to the disease, and the easiest way to frame that is if you have a first-degree relative with prostate cancer, meaning your brother, your father, or a son, that puts you at some increased risk for prostate cancer. We recommend that you get screened earlier for the disease than you would otherwise be. Either way, it's a decision that you make with your primary care doctor. So prostate cancer, because it's such a slow-growing disease, often doesn't, even if it's present, never causes an impact on a patient's life expectancy or on their quality of life. So that decision about whether or not to pursue prostate cancer screening is an important one to do annually in the context of a primary care visit.